Welcome to our annual members meeting. Thank you for taking the time to join us for what I know you will understand to be by necessity and design very different to our gathering last year. Like other NHS trusts and countless other businesses, we've embraced modern technology to enable us to get together virtually, although I'm not quite clear whether modern technology has embraced us. The governance, communications and technology teams will support us through this, but please do bear with us as our meeting tonight will be a combination of pre-filmed and live sections. Before I talk through our plans for the evening in more detail, I'd like to briefly hand over to our Trust Secretary, Deborah, to explain some of the housekeeping rules.
Thank you, Amius. Just to let you know, we're recording the meeting today, and we will record the numbers who've attended in our minutes. Where you've entered your name when you joined the meeting, we'll log you as an attendee. The meeting, in terms of managing the meeting, all of our guests are automatically placed on mute, so we will not be able to see your video screens given the numbers that we have attending the meeting today. You can, however, ask questions throughout the meeting via our written chat box. Every guest will be able to view the questions that you've asked, and please feel free also to comment on any questions raised as we go through the meeting if you wish to do so. To type in your question, you need to click on the small box with a question mark on it on your screen. Please add your name to the question so that we can identify you and ask the question on your behalf at the end of the meeting. We'll then be able to record it in the minutes for you. Where there are multiple questions that are the same, we'll aim to theme those together. We've set aside 30 minutes for the Q&A at the end of the meeting, and our Acting Chief Executive, Jason Sees, will receive the questions from Justine, who's the Head of Communications, and will ask relevant colleagues from the board to answer them for you. I'll now hand back to Amius.
Thank our governors, members and our community here at Hillingdon for their continued support and for your messages of encouragement. I can't talk to you today without referencing COVID, although this occurred in the current financial year. More will be said about this later, but I wanted to say how humbled I've been by the direct support of our staff received from the community in providing food and supplies and messages of support and thanks to our staff, which I know have been very gratefully received. I also need to say our staff have been fantastic through this crisis. I hope you enjoyed the film we showed you before the meeting began, which talked about our earlier COVID journey. Please do watch it after the meeting if you missed it today. It will be available to view on our website this week. It means so much when our staff, our management and our board know and feel the backing of our local community to our transformation plans, willing us to do better, continuously improving and supporting our dedicated staff through what has been an unprecedented time in our country and for the NHS. In a few moments, I'll invite the lead governor, Tony Ellis, to speak. It's an indication of the regard in which we hold our members and governors that we've ensured that Tony has been asked to talk with you today. I feel this is important given that this is the annual meeting of the Trust with its members, and is an indication of our determination to involve our members and governors more in the life of the Trust as we move forward together. We will receive updates first from him, the lead governor, Tony Ellis, on the role of governors and their engagement with the Trust and our communities, from our acting CEO, Jason Sees, who will talk to us about recent events, as well as looking back over our annual report and looking forward to the future. From our interim Director of Finance, David Meikle, will outline the annual accounts and findings of the auditors. And from our Medical Director, Dr. Catherine Cale, who will talk to us about quality, our operational performance, and our work to address COVID-19. And also from our Director of Estates and Facilities, Tahir Ahmed, and our communications colleagues, who will provide an update on the exciting new hospital redevelopment plans. This meeting has several formal elements. We need to accept the minutes of the previous meeting, consider the Trust's performance in 2019-20, receive our annual report and accounts, as well as receive and respond to questions from our members. Before I hand over to our presenters, can I please ask those who were present for the last annual general meeting members meeting to approve the draft 2019-20 annual member meeting minutes. And I'm going to take silence as a sign of assent. So thank you for that. And without further ado, I'd like to hand over now to the lead governor, Tony Ellis.
As many of you will know, I've been a governor since Hillingdon became a foundation trust in April 2011. It has been my privilege to be the lead governor for the last 3 years, and I hope to be re-elected later this year. What do governors do? The overriding role of the Council of Governors is to hold the non-executive directors individually and collectively to account for the performance of the Board of Directors and to represent the interests of the Foundation Trust members and of the public. We do have many other duties, such as appointing our auditors. The Council of Governors comprises 13 public governors who are elected by the Trust members, 7 staff governors who are elected by the Trust staff, and 4 appointed governors who represent stakeholders. All of us are elected and appointed for a 3-year term, and elections are currently being held. The closing date for elections for public governors is 5 p.m. on the 28th of September. Please cast your vote if you haven't already done so. The election for staff governors has already been concluded. What do we actually do? Annually, we hold 4 Council of Governors meetings and the annual general meeting, which are open to members and the general public, who can ask us and the board questions. We attend monthly board meetings, are represented on board committees, do hospital walkabouts, hold regular briefing sessions with the board, have training sessions, attend meetings held in the community, such as at residents' associations. We appoint non-executive directors and agree their remuneration. We also feed back to the board any patients' and concerns that are raised with us. The COVID-19 pandemic has drastically changed the way we work, as we are no longer allowed to attend our hospitals. As this meeting is being held by Microsoft Teams, we also carry out our meetings on Teams. Apart from not being able to do walkabouts and engage with staff, patients and members on a one-to-one basis, I feel that we continue to carry out our duties effectively. Work is underway to improve our public, patient and membership engagement, aligned with our new hospital development programme. The Trust will be holding many consultation sessions about the new hospital, and it's hoped that many of you will take part so we can ensure that we provide a hospital that Hillingdon residents want. As at the 31st of March 2020, the Trust had 4,703 public members and 3,818 staff members. It is our aim to increase our public membership by at least 10% in the next year. Would current members please ensure that we have up-to-date contact details, especially your emails, as the only way we can afford to contact every member is electronically. We have introduced the members website recently. Details are on the slide. There are also details on the slide as how you can become a member. For membership support, you can contact either the Trust Secretary or the Assistant Trust Secretary as shown.
Thank you. Can everybody hear me, hopefully? So good evening. My name is Jason Sees and I'm the Acting Chief Executive. Apologies for some of the technical difficulties. I'm on my trusted Commodore 64, so hopefully everything going forward now will be working. So this evening, I'm going to talk about our achievements in the financial year 2019-20 and highlight some of our ambitions for the future. So just want to recap on some of the key headlines in the previous financial year, which was April 2019 to March 2020. The key headlines are that over the last year, more than 500,000 people have come to our trust for care and treatment. That's over 500,000 people's lives have been touched by our work here. Over 4,000 babies opened their eyes for the first time in our maternity unit, welcomed into their families and into our community. Nearly 100,000 people came into our A&E and our minor injuries unit. Each of these people putting their trust in our trust. The key bit for us with that is that what we do here is we are putting patients at the heart of what we do. Our vision going forward is to be an outstanding provider of healthcare. Our mission is to provide high quality, safe and compassionate care. And our CARES values, communication, attitude, responsibility, equity and safety are at the heart of what we do. Our hospitals aren't the biggest, they certainly aren't the newest or the best known, but I know our staff are real superstars and I am proud to work alongside them. How everyone responded to the challenge of the COVID-19 pandemic was amazing, and I'm very proud of the efforts of all our staff. If we move forward a slide, there is a slide that highlights some of the key achievements of our staff in the previous financial year. And it's just to highlight one of the main thrusts that we're still taking forward is our CARES Plus improvement methodology, ensuring that our staff at all levels of the organisation are driving forward our improvement programme. So, conscious of time, that's a brief run through of the last year. There is a piece also tonight that I just want to spend a little bit of time about looking ahead. In the current financial year, so from April onwards, we had a recent visit from the Care Quality Commission, that's the CQC, who are the key regulator of quality for the NHS. They conducted an unannounced inspection of our Hillingdon hospital just at the beginning of August. As a result, the CQC set a number of conditions for the trust to meet, and we have taken immediate actions to improve safety. We have made changes to our physical environment, and we've put in place better social distancing, reviewed our procedures, and we are making sure that on all fronts going forward, we are becoming systematic in the way we provide our systems and processes to support our staff. The safety and well-being of our patients and of our staff are at the heart of everything we do. And these urgent improvements will continue, particularly around infection prevention and control. We believe that we are making progress, and we want to assure our staff, patients and the wider community of our absolute commitment to their safety and well-being. Going forward, we are absolutely focused on ensuring that our hospitals provide high quality, safe and compassionate care. In tandem with this, we are driving forward the building of the new Hillingdon Hospital. We will do this in partnership, continuing to build on our close working relationships with our local GPs, our charities, our community services and academic partners, our local authority, neighbouring hospitals and the wider North West London integrated care system, and ensuring that we listen and work in partnership with our local population. I would also like to assure members that we have plans in place going forward for the preparation of a possible second wave of COVID. So to finish, thank you very much for everybody joining us tonight and their patience just at the beginning as we sorted out some technical issues. And I will now hand over to colleagues to continue the annual members meeting. Thank you.
Thank you, Jason. I'll pick it up from here. Good evening, everybody. My name is David Meikle. I'm the Interim Director of Finance for the Trust, and my role this evening is to present to you the results of the financial performance of the Trust in 2019-20. And in doing so, I will highlight some of the key points raised by the Trust auditors, Deloitte, in their audit of our accounts. NHS provider trusts are set a financial target at the start of the financial year. Thank you very much. NHS Trust has set a financial target at the start of the financial year. To achieve that target, they set themselves a financial plan, both an income plan and an expenditure plan, and also a capital spend plan and a cash balance plan. And if we hit those plans, then we hit our financial targets. And by hitting our financial targets, we have access to additional funding, which is called a financial support funding for NHS trusts. However, as a result of operational challenges faced in 2019-20, including the need to invest further in staffing to address and maintain quality and performance, and also to invest further in our estates, we did not achieve our financial plan, as this slide shows. And more specifically, as you can see, in 2019-20, we had a plan to achieve a £23.7 million deficit. That compared to the deficit in 18-19 of 27.7. So you can see a £4 million improvement was a plan for 2019-20. However, in achieving that plan, we would attract additional funding of 21.1 million, leaving us with a net deficit in the plan of 2.7. So as you can see, the importance of achieving our financial plan, therefore achieving our targets, would attract an additional £21 million of additional funding to the trust. But as reported in the slide and within our annual accounts, the trust actually achieved a £34.5 million deficit, and that does refer. Keep on to the previous slide, please. Thank you. That does refer to the spend that I was talking about on additional staffing and additional estate spending. However, the plan was phased such that we did attract some additional funding at the start of the year, 8.4, and therefore we finished the year with a net deficit of 26.1 million. A key component in any financial plan of any NHS trust is its savings plan. And as you can see, the savings plan that the trust had set was 11.7 million for 2019-20. Sorry, and in achieving that 11.7 million, you can see from 16 to 17, we were expecting a real ramp up in the plan. So at the start of the financial year, the first 6 months, our actual, as shown by the red line, was very much on plan, and hence why we did attract that additional funding at the start of the year. But as the challenge got greater in the second part of the year for the trust with regard to a savings plan, we undershot that savings plan, such that our final value was 8.1 million against the 11.7. So as we moved our deficit up to over 34 million, a major component of that was a non-achievement of this savings plan, as you can see in front of you. However, moving on, looking at the capital side, the trust continued to invest heavily within its estates, within medical equipment and in IT. And as the slide demonstrates, we spent over £25.5 million in 2019-20 over a wide range of projects, including UTC scanner and mobile X-ray equipment, to continuing investment in the digital infrastructure, and more importantly, I think, to continue to invest in our wards and the overall environment in which staff care for patients, and patients accept the service that we provide. As you can see, that a fairly large investment given the level of spend and that we have within the trust. Moving forward into the current year 2021, the trust will continue to invest heavily in infrastructure, and we have approval for 69 million. So 25 million last year, 69 million this year. And yet again, that's over a range of programs and projects, including the estate and preparing for the new build and the investment in temporary ward accommodation, which we're busy making operational at the moment. However, in common with the rest of the NHS, for 2021, we are refreshing our financial plan. The first half of the year was badly affected by COVID from a financial perspective, And as we plan for the second half of the year, we're working with colleagues in the CCG and within the ICS and with NHS E&I to develop a financial plan for the second half of the year that takes into account both our winter activity and our projected COVID-19 activity for the second half, and also for the recovery of elective activity in the final 6 months. That plan is emerging, and we're hopeful that we will be able to present it to the board in the coming months. In addition, looking ahead, we're also remodelling a financial plan to support the business case for the new hospital. As Jason has indicated, we're going through the process of developing the business case and the architecture of that business case, and the finance team are supporting heavily to ensure that we have a robust financial plan that supports the new hospital and supports the trust as it goes forward. But before I finish, I think I'd like to highlight a couple of points raised by the auditors. I think is the next slide, I believe. And this slide does highlight an overview that the positive side, that the trust got a true and fair view audit opinion from the auditors, and also a confirmation that the accounts have been prepared in accordance with the regulations and guidance from our regulator. However, there were two issues of material uncertainty, and these are basically related to the wider impact of COVID-19. The auditors raised a point with regard to going concern, because because of the revision of the financial plan going forward, there was no guarantee of future income, but we are working with that across the NHS. All trusts are in the process, as I said earlier, of refreshing their financial plan, and the auditors made that point within their statement. But however, if people are interested further, the statement, the audit opinion is attached to the annual accounts, and we more than welcome any questions that you may have on that opinion. At this point, I will stop on the financial presentation and pass it across to Kathy, who's going to pick up the quality presentation. Thank you very much.
Thank you. So, hello, good evening, everybody. My name is Kathy Cale. I'm the Medical Director here at Hillingdon Hospitals. Next slide, please. So, normally at this point in the year, we would have published our quality account, but in line with national guidance, preparation of the quality accounts was delayed, so that will be published later in the year. However, we have continued to review our progress against our quality priorities for 1920. And with stakeholders, we have agreed our priorities for 2021, which are listed below on the slide. And they're a specific subset, really, of the areas where we feel significantly more progress in these will really provide maximum benefits to patient care around improving our discharge processes, patient information complaints, and particularly for our patients with learning difficulties and their families, how we engage with them. Next slide, thank you. So I'll just give you a flavour of some of the areas that we think are really important and we're continuing to focus on as we focused last year. So the 4R standard is a key objective for all trusts, and it's not just about our emergency departments, it's about people being in the right place and flowing through the whole hospital appropriately. We had a target to achieve 90% by the end of March. We didn't reach that, we made 82.3%, but we are continuing to work to improve that. There were complicated reasons why we didn't get to that, but however, despite that, we have made significant improvements. We've looked at how we care for patients when they're actually in our emergency department to speed their journey through. We've looked at how we use ambulatory care, so just seeing patients and not keeping them in hospital, but giving them treatment and sending them home. We're working with our partners really importantly to make sure that you're only in hospital for as long as you need to be in hospital, and we're discharging people in a really timely manner. Next slide, thank you. Obviously, treating all conditions is really important, and we're aware, particularly over the last few months with COVID, there have been significant concerns about patients with cancer continuing to get treatments. We have achieved the target for all cancers last year. A lot of the other targets we've fallen a little bit below. Some of those it's very difficult because we have small numbers of patients, and in the annual report there's a lot more detail about that, and we continue to try and drive those targets forwards because we all know that getting prompt treatment for these patients is incredibly important. Next slide, thank you. One of the really important things that we focused on last year and this year is infection prevention and control. And Clostridium difficile, which is an organism that gives you diarrhea and can cause you nasty problems if you're unwell, is very important. We had a trajectory of having no more than 24 cases last year, and we just achieved that. Next slide, please. For everybody, there was a change in the case definition between 1819 and 1920. So all trusts have seen their numbers go up a little bit. But actually what you can see in that graph is we've maintained our focus on reducing absolutely where we can the amount of C. diff infection that we have. Next slide, please. Moving on from infection prevention control, is not, things don't always go right, and we absolutely encourage people to report that within the organisation. We review all adverse incidents and their impacts on patient care, and we do that in a really regular and systematic way. And where those incidents fall within the National Serious Incident Framework, we investigate them under that framework. The really important piece is that we learn from these incidents, and that's what we're trying to do, we investigate. So this chart shows you how well we've done in actually completing our incident investigations in the timescale that we're required to do it. And the teams have all done really well on improving that. So now, since September of last year, 100% of our investigations have been completed in a timely manner. Now, that doesn't matter in terms of a process metric, but it does matter. It means that we've learned from them quickly. And what we're really focusing on is making sure that we embed that learning within the organisation. And that's one of our focuses for this year. Quality of our investigations is provided by external assurance by our partners in the clinical commissioning group. Next slide, please. Obviously, a number of our patients do sadly die, but our mortality indices, whether we look at HSMR or SHIMI, that are two slightly different ways of measuring mortality, are within expected limits. We do investigate deaths where we feel that something hasn't gone well. And we have a number of ways of doing that, both by serious incident investigations and also another methodology called structured judgment reviews. And we share that learning across the trust, and we've got a number of forums in which we share it, including a regular meeting we have every month where we can have confidential discussions, and also a learning and safety bulletin that we publish every month. Next slide, thank you. So finally, just to talk a little bit about COVID-19, which Jason mentioned. Obviously, COVID-19 started at the end of the last financial year, but it impacted on us significantly in March and peaked in mid-April. It's gradually reduced since that time, but unfortunately we're starting to see, as you all know, numbers rising again. And it significantly impacted the organisation over the spring and the summer. As Jason said, we're all incredibly proud in the way that our staff worked during that time. They worked amazingly hard and provide care for all of our patients in really challenging circumstances. We did lots of things differently to manage care and make sure we provided good quality care during COVID. We had an instant plan that we used, and when we talk about a command structure, that means a daily rhythm. That means everybody knows what they're doing and we can make decisions quickly. We've got a risk register where we could make a note of things that we were worried about and make sure that we've got actions in place so that we were protecting from those things happening. And really importantly, we've worked throughout this time to strengthen our infection prevention and control, and to demonstrate both to the board and also our external partners that we are doing the things that we need to do. We recognise that, as with the rest of the NHS, a lot of people didn't get treatment during COVID because we had to pause elective procedures, tried to carry on outpatients where we could, but we continue to monitor that, and we're working really hard to restart our planned care as quickly and safely as we can so that we can deliver care to everybody who needs it. So thank you, and I'm going to hand over to Tahir, who's going to talk to you a little bit about redevelopment and estates.
Thank you, Kathy, and good evening, everyone. I am Tahir Ahmed. I'm the Director of Estates and Facilities. I'm going to take a few minutes just to walk you through the high-level position in relation to our estate and the redevelopment. Thank you. Next slide, please. This slide is just intended to give you some orientation as well as a general visual oversight of the estate. We have 95,000 square metres of the site, of which we occupy circa 50% of the site, largely made up of low-rise, single-storey, modular type buildings. Thank you. Next slide. Now, this is not a slide that I'm particularly proud of, but it is unfortunately a reflection of some of the building infrastructure here at Hillingdon hospitals. It is no surprise to note that the over 80% of our estate now at Hillingdon is either beyond economical repair, and really what we need is a new modern hospital, which I'll speak about shortly. Thank you. The basis is that we're looking to now, through this options appraisal, which I'll touch on in a moment, we've identified Hillingdon Hospital as an opportunity to build the new hospital on what is shown as the red part, or part A of this particular slide, which currently comprises low-rise, poor quality assets at the moment. The idea is to move them over to the area which is B, where we retain much more of the high-rise and better quality assets, and of course allow the hospital continue in its entirety fully operational whilst we build on the site A. What we do as part of the master plan is we look at it as a collective, so A and B produces C, which therefore is available for any future expansion and a variety of overall complementary hospital type functions as we look at the site as a total master plan. Next slide, please. So the master plan approach has been, as in the best possible way with all architects and engineers, we start with a general concept idea. This manifested into initial master plan, which shown here shows the hospital development on the west side of the site, where point A was. We've been in an extensive dialogue process with both engineers, the local authority, and with stakeholders to look at how that can be developed in more detail for our strategic outline case, and how that supports the hospital, not just for the new build, but in its current business as usual state as well, which helped us produce a strategic outline case. And we're now looking forward to moving into the next stage of the development, which will be the outline business case. Thank you. Next slide, please. This slide looks at some of the guiding principles that we use when developing a hospital, and what they look at, and they work on the basis of something known as the Urban Land Institute Building Healthier Places Toolkit. It's not only looking at the functional suitability of the hospital and the environment in which people work, live and visit, but it also looks at the societal benefits of how that hospital responds, not just to the immediate users of the building, but the surrounding areas as well. So it really does embrace the community requirements of how that hospital fits into that ecosystem and the wider sector. Thank you. Next slide, please. Unfortunately, Sarah Bellman won't be presenting today, but I just wanted to say on the communications and engagement side of things, we do now have a very extensive website and information in relation to the communication and engagement that we've now commenced. This is all available on our internet pages for you to log on to and ask as many questions as you wish, and indeed engage in the process as well. There's a very extensive and well maintained feedback loop as well, so we are definitely listening and taking on those best practices and ideas that may come forward through that. Sarah will be available at the end of the presentation to take some more questions around the engagement plan. And again, just this slide demonstrates the fact that we do not just engage with our immediate stakeholders, but we are taking on board the wider integrated care partnership, the integrated care system, the CCGs and all the various other scrutiny committees that are involved in and have a keen interest in the development of the new hospital as well. Again, this information is available on our internet. Thank you. Can I have the next slide, please? Thank you. In preparation of the hospital development, one of the things that we have done, and David Meikle, our finance director, did actually mention this as well, we've now started to introduce some modular wards. What this is allowing us to do is not only move out of that suboptimal hospital ward accommodation into very nice fit for purpose accommodation, but also allows us to de-risk the site or remove those dilapidated buildings and wards, making way for the new hospital. May I have the next slide, please? So progress has been made in consultation with our Chief Operating Officer, Tina Benson. Clinical groups have been set up and ensuring what we now have is Modular South, or the Sequel building. We've been able to develop this as part of supporting not just our clinical services strategy, but our overall enabling and decamp plan as well. We now have a series of a 3-storey building which accommodates a modern ward accommodation on the ground floor, with preparations for an intensive care unit on the 1st floor, followed by a respiratory ward above that as well. So we are indeed planning a little bit for the future here. May I have the next slide, please? Now, these wards will be fully operational by the end of 2021. I will add that the Franklin ward on the ground floor is indeed operational. However, we then have further plans in place to bring on board the next set of modular buildings as well. If I may have the next slide, please. I think this is a video. So where are we now? We, as of the 28th of July, the board approved the submission of the draft strategic outline case for our new redevelopment and submitted to our regulators, NHS Improvement and NHS England. Based on this, we identified a number of options, which identified the new hospital to be built on the Hillingdon site, the image that I showed earlier. We have begun that community conversation and we'd love to hear from you, so please do participate in that. And of course, the redevelopment of the modular wards continues. Whilst we move forward to the next stage of the OBC, I do have a little timeline on the next slide, please. So we've submitted our outline case. It's with regulators. We've had an engagement process with them. The plan is that will be put forward to allow us to move into the outline business case stage, which we will develop, and that's a more detailed development between September this year, leading us to July 2021, and that's where we get into the real detail of the design and the accommodation. That will then take us to a full business case, which is where we test the building, both in procurement as well as in strategic fit. And that will be from July 21, leading us to the end of 2022, when we hope for first spade in the ground to start the new build on the new Hillingdon Hospital site. Thank you. Next slide. Thank you. I think that's the end of the presentation.
Thank you, Tahir. So, conscious of what we set out initially in terms of our agenda for tonight, we were broadly aiming to go through the main presentations and finish by 6 o'clock in order that we'll be able to take half an hour for questions. Again, apologies for the sort of late running, but we've sort of made up the time as we've gone through the presentations. In terms of the questions, we've got 2 so far that have come in, and I'll group them together for our Chief Operating Officer, Tina, to answer. The 2 questions for Tina are the future of the minor injuries unit at Mount Vernon and how that will be taken forward, and another question related to the backlog of planned procedures following the sort of significant sort of reduction in planned care during the course of the first months of the COVID pandemic. So Tina, hopefully you will be able to appear through the magic of technology and answer these 2 questions.
Hopefully you can see me now. My camera is on. So I'm Tina Benson, I'm the Chief Operating Officer. So I'll start with the minor injuries unit. So during COVID, as many of you will know, we temporarily closed the minor injuries unit, and it was used as a hot hub for patients not requiring hospital care that had potentially had COVID that could be looked after by our primary care colleagues. That was actually a very successful and welcomed initiative by the local population. And so what we are looking to do is provide an enhanced offering at the Mount Vernon site. So it will be more than the minor injuries unit. It will be minor injuries plus urgent response in terms of GP and primary care. It will be under the banner of our Hillingdon healthcare partners, and we will work together to deliver more and more services at that urgent care hub. Working with the National Urgent and Emergency Care team, we are looking at how we make as much urgent care, so not emergency care where you would need an ambulance, but urgent care bookable. And the purpose of that is to ensure that we can manage flows and keep patients socially distanced and safe. So there's a lot of communication going on at a national and London level around this, and so there'll be more information coming out about that. At the moment, we're in pilot phase of this new model, working with just a couple of GP practices in Hillingdon to make sure that we get both the technology right, so that our teams can virtual consult when appropriate and book patients in within 2 hours to be seen where they do need to be seen face to face. So that's in pilot phase, and the plan is, as we improve that process, that we'll be going live with all of the Hillingdon practices in October. In terms of the backlog of surgery, we have restarted now all elective surgery, both at Mount Vernon and some at Hillingdon, with more still to come at Hillingdon, with more theatres opening in the first 2 weeks of October. In terms of how we're doing that, in terms of planned procedures, our clinical teams have been reviewing the waiting lists and giving each patient a clinical priority. So we are looking at those who need their operations or their procedures more quickly, and we are booking those into the slots first, and we will continue to do that until we get back to a more business as usual rhythm. In addition to that, we have our second wave COVID plan, which means that we will be able to continue elective operating for longer and for as long as possible should we go into a second wave of COVID. Whereas the first wave we had to stop quite quickly due to staffing resources. We're working across the sector, so with the North West London ICS, to make sure that we can maintain some elective work should we need to have additional resources. And it's really important for us at Hillingdon to work with the wider sector because as an acute trust, we're actually relatively small, and that gives us additional support and access to additional theatres, for example, so that we can make sure those most urgent patients are seen as quickly as possible.
Thank you very much, Tina, for that. We've got a couple more questions which I'm going to pass on to Tahir. Both relate to the presentation on the Hillingdon Hospital site. So the first question is, in the master plan, why are you keeping the tower block, which is falling apart and an eyesore? And with that, where is the green space for the new hospital gardens, outdoor seating, etc.? And a similar question around that concerning the tower block on, will it remain or will it be demolished? So Tahir, the tower block et al. Over to you. Thank you.
Thank you, Jason, and thank you to Graham Bartram and also Steve for raising those questions. I guess the tower block is a funny building. It was a great building of its time, built in 1967, but of course things have moved on and standards have changed as well in terms of hospital design. There'll be many that will share these sentiments around the building and its future, but of course let's not forget those who are equally interested in buildings built around the 60s and 70s. You will be pleased to note that as part of the new hospital development, we are looking for a single phase development. So we won't be retaining the tower going forward as part of the new hospital development. All of the accommodation will be moved into new fit for purpose modern day hospital environment. As part of that design development that we're doing, we will be looking at and have already been exploring building not only the most sustainable hospital that we can achieve here, but also making something which is known as placemaking, a place in which you can gather, a place where you can provide seating and comfortable outdoor arrangements for staff, patients alike, and visitors, of course. So a great part of what we're doing as part of the master plan just doesn't focus on the building, but it, as I've mentioned in my presentation, it focuses on the societal benefits of having this ecosystem that provides for the community as well. So in consideration of that, we are speaking to the local authority and plans are going to be put in place for developing pocket parks and outdoor space that can be used more efficiently and appropriately around the hospital community as well. Thank you, Jason.
Thank you, Tahir. There's questions now coming in thick and fast. If I can just keep with Tahir before I pass over to sort of more questions for Tina and Kathy. There's just been a question about if you could just explain in a bit more detail about how we move from strategic outline case to the outline business case and the preferred way forward being the Hillingdon Hospital. But in that context, about how the options are taken forward and are they set in stone?
Okay, so the options that we have taken forward, naturally there will be the strategic outline case or the outline business case is set up on the NHS Green Book requirements, which sets out the standards for all business cases for all major developments. Within that, we have to have a number of options. As a minimum, we look at 3 options. So we have indeed looked at a business as usual. Is that a viable option going forward if we are to continue business as normal? We also look at what we need to do as a do minimum option, which looks at the bare minimum of addressing the requirements of Hillingdon while maintaining safety standards where possible as well. And of course, the third option that we'll need to look at is the preferred option, which is what does really Hillingdon need? What does the community need? And what services do we need to provide here? So what our plan is to work through those options. Those options will go through a very rigorous process of a 5 case model: strategic case, an economic case, a commercial case. And of course, looking into that, many will argue there needs to be an estates case, but of course that is embedded within that process as well. So that is the process we are going through at the moment. Through all of these processes, there will be a level of detail. As we then emerge as the preferred option, that option will be given due consideration both in design and operations. And it's that we will be looking at right through those 5 facets of the investment case for formal approval by our regulators to proceed around 2022.
Thank you very much, Tahir, for that. So there's been a question concerning our colorectal cancer services and again how they're being prepared and being taken forward. So if it's all right, I'll just pass back to Tina Benson, the coup.
Yep, so indeed our colorectal cancer cases have restarted. And you're right, whoever raised the question, that it could lead to additional waiting lists down the line, because we know that many patients either haven't gone to their GP, or they haven't been referred in, or indeed they haven't wanted to come to the hospital during this time. So we are prepared for additional activity. We've done very clear modelling, predicting what we believe will be future demand, whilst obviously that is some science and some guesswork, and we are ready for that. Having said that, we do have a backlog in our diagnostic services, particularly CT and endoscopy, and we were working with the teams and again across the ICS to make sure that the most urgent patients get seen first, and then we start working through those who have been waiting the longest. So we have a clear plan at sector level, which is monitored every week. So yes, we have restarted all our cancer services, and we are prepared for the additional demand that may come as people start going back to their GP, or decide that really now it is time to not ignore their symptoms if they have been doing so.
Thank you very much for that, Tina. There's also a question about virtual consultations and how they've been taken forward as first outpatient appointments. Kathy, are you happy with that one? Thank you.
Thank you, Jason. So as everybody will know, that we switched very much during COVID to using virtual outpatient consultations as much as we could. And we've continued to work with all of our specialties to maintain that, because for very many appointments, actually a virtual consultation meets the need both of the patient and the doctor or the nurse who is seeing that patient. However, it is a really careful balance, and for some patients we absolutely need to see them face to face. Some of it is about doing investigations and about examining the patients, and there are some groups of patients where actually it's really important that that you meet with them as part of your clinical assessment. So we're monitoring really carefully the number of appointments that we use face to face, and the number of appointments that we're doing virtually by phone or video. And we're also gathering feedback. We've got this as an improvement project using some of our improvement methodology. So we're making sure we get feedback from patients and feedback from our teams about what works for them. So you're absolutely right, we need to be using virtual consultation where we can. It has all sorts of benefits, like, you know, decreasing pollution and saving people having a lot of time from work and sorting out childcare and things. But also it has to be used proportionately. So we're absolutely making sure that we keep measuring that and learning from our colleagues who are all on the same journey around that. Jason, should I pick up the CPAP question as well?
Yes, right. That's Kathy.
Yeah. So there's a second question, well, not a second question, a question about why is A&E not accepting patients who are using CPAP and BiPAP. So for those of you that don't know what CPAP and BiPAP are, they're a way of supporting people with their breathing, which involves having a mask on your face, so it's not having a tube down, and it's something that a lot of people actually use at home overnight, things like that. And it's also a means that we use to support people's breathing when they don't necessarily need to go to intensive care, but just need a little bit of help. So you will all be aware that we had a COVID outbreak in one of our clinical areas at the beginning of July, and as part of that we paused accepting patients who needed NIV, so CPAP and BiPAP, and that was because we have specific nurses who are trained to support patients with that care, and it was quite a few of that group who were off for a period of time. So what we've done over the last few weeks is we've taken the opportunity to retrain some of our nurses, to expand some of the skills that they've got, and also to do some estates work to the ward environment in which they're working. It's a different environment to the environment pre-COVID, so we've done lots of work around that. And the good news is that we started taking those patients onto the ward again yesterday. I can say that the nursing team are absolutely thrilled, as were the medical team, because they've done a lot of work to make sure they can provide really good care. So at the moment, we're just taking a small number, and then we'll go back up to normal numbers from next week. So going forwards, we will be absolutely back to providing that normal level of care that we've done. And we did it so that we could make sure that we were able to provide really safe care for all of our patients throughout that time period.
Thank you very much, Kathy. Tina, there's a question concerning our A&E service and about how we work in sort of partnership with NHS 111. Would you like to pick that one up?
Absolutely. So the initiative that you mentioned, Rosemary, is actually a national initiative, but we have to be quite careful with our language. So what we would like people to do is contact 111 first, so that we can, as I mentioned about the minor injuries unit, we can actually book them into a slot to make sure that the departments don't become overcrowded. We can maintain social distancing and that we can see people in a timely way. This is going to function in a number of different ways. So firstly, 111 will be able to book directly into the urgent treatment centre, if need be, book into ED just so that we know the patient is on their way, and also, more importantly, book into specialist clinics and ambulatory care, which Dr. Kale mentioned earlier, so that we can get those patients to the right place, and hopefully where they don't need to be in A&E, that they don't have to go to A&E. But it is really important for the public that actually this does not stop people who are urgent or actually don't know the systems to get into urgent care. They can still come to the UTC and the A&E without going through 111, but it is clearly our preference that they do, because it does allow us to manage that flow and keep all of our patients and staff safe.
Thank you very much, Tina. Just going to pass back to Tahir. There's been a question concerning the new hospital development and how we will incorporate transport facilities, particularly a bus station, and also a sort of a tandem question with that about our planning of transport links at Mount Vernon. So Tahir, over to you. Thank you.
Thank you, Jason, and thank you to Tony for raising this particular question. I'd like to put this into the bag of sustainability as well. It's something we as a trust are taking very, very seriously, and it's something that we're very passionate about. It's not the fact that the hospital is in a dilapidated estate and we haven't done anything. Of course not. I'm very pleased to announce that we only last week won the International Green Apple Award for Sustainability, which is a real testament to the work and in particular hard work that the waste management and transport teams are doing here as part of the sustainability agenda that we're doing at Hillingdon Hospitals. So to get that on the backdrop of our estate is a huge credit to the teams. Part of the work that that particular team is doing is looking at the transport links. So we are now about to go to our board on a green travel plan, which is a joint piece of work that we have done with Hillingdon Council as well. And of course, the work that we continue to do with Transport for London as well. This is going to form part of the wider Sustainable Delivery Management Plan, which looks at the wider context of carbon neutral, etc., in terms of the new hospital. To answer the question specifically, the redevelopment, what we are planning as part of that, and conversations have started, is to introduce a new bus stop, or a significantly enhanced bus stop on the hospital estate. So we're not using up the road, we're bringing this into the hospital. That not only provides an enhanced bus service, but also provides great pedestrian access straight into the hospital as well. And to add to that, as part of our sustainability drive, we are encouraging the use of hybrid buses as well, which will bring in those electrically charged buses to reduce pollution in the area. So this is something we're extremely passionate about. I would like to add, if I have a moment, that we are already using 100% renewable electricity here at the Trust. So that is using biomass technology, wind power and solar power technology to fire up the hospital's electricity requirements as well. We have zero to landfill at the moment, so none of our wastage is going to landfill sites, rather we're using this to produce energy. And at the moment that's estimated that we are feeding 55 households a year just in using that particular form of zero to landfill approach as well. I could go on with the number of initiatives we're doing on the sustainability side, but I will add that transport and the buses is a real key part of our new master plan. So thank you for the question, Tony.
Here, if you just don't mind staying with us for a second, again, in the sort of all the and everything that goes on with the development of an outline business case and that detail we have to go to in outlining what's going to be in the new hospital, there's been a question about hospital radio and what is our plans around the new hospital having sort of Radio Hillingdon incorporated into the plans.
So yes, there's a wider agenda here, of course, Jason, and that is around the digital agenda of being able to interact not just within the hospital, outside the hospital as well. So as part of our digital strategy, we will be looking at a number of communication mediums, which will not simply be limited to a radio station, but that is, of course, on our agenda indeed. But we look at other mediums of communication and get that messaging across the digital airways. I'm sure our digital colleagues will be able to tell you more about that, and we're happy to provide more information as necessary.
Thank you very much for that, Tahir.
You're welcome.
There's been a sort of wider question just around our communications and engagement going forward, and how we're sort of really ensuring that we're using sort of all the mediums to do that, and how we're taking our programme forward. Justine, are you there and able to just go through how we're taking our plans forward? No, so unfortunately, apologies on that one. We don't seem to have our director of communication.
I'm here. Hello, Jason.
Okay, through the wonders of technology, here we go. So
Jason, there are actually two questions that relate to communications, and I'll take firstly I'll take the one about our engagement around the redevelopment. I've actually put some information up on the chat line, including our redevelopment website. There's a colleague of mine from the CCG, Sarah Bellman, who's working very closely with us, is giving us additional support on the redevelopment programme. And that's because it's such an important piece of work when it comes to communications and engagement. Sarah, if you're there and would like to say a few words, I'm going to ask you just to say a few words on the engagement work.
Hi. Yes, of course. So we're at the moment doing quite a lot of planning around the engagement. We have got the website launched now, and there is some feedback on there, feedback form on there. We've already heard from over 250 people from across the borough and staff, which has been really good to get that feedback. A big part of what we're doing is making sure that through our engagement and through things like the soon to be launched newsletter, that we are showing how all that feedback is being listened to and is helping to shape the plans. And that feedback will, the feedback survey will sort of change over time so that people can feed into specific aspects. One of the biggest challenges that we've got around engagement at the moment is that a lot of the traditional routes are quite problematic because of COVID restrictions, but we're working with our partners and we're working with people across the community, faith groups, schools, residents associations, just to make sure that we are reaching out as far as possible and that we are not just relying on the sort of online media to reach everybody.
Thank you very much, Sarah. The second question was about the aim of having a members site. It's actually a microsite, a bit like our redevelopment site. Excuse me for taking my mask off. Our redevelopment site is actually a special microsite. We've done the same thing for members. It's really at the very early stages of development, and our aim is to improve our engagement with our members. And really, over the next few years, we want to make sure our membership grows quite rapidly. We're looking at increasing our membership of the Trust by 10% this financial year, and then onwards afterwards as well. And the micro website is actually one method of being able to make sure that we can have a conversation with our members and really sort of engage them and involve them in the life of the hospital at Hillingdon and the life of the hospital at Mount Vernon as well. Really important to make sure that both our sites are covered and that our members know what's going on at both. So over the next few months, I hope that you'll see more information being put on the microsite, and hopefully we'll have more events for members, and we'll be able to make sure that you can see in different ways what we're actually doing through the trust. Obviously, with the COVID situation, we've got to use modern technology, and sometimes it doesn't go quite as smoothly as you'd like. But I thank you very much, everybody, for bearing with us on the technology this evening, and please do keep an eye on the microsite for members. Thank you.
Thank you very much for that. There's been a question concerning the Prime Minister's announcement today. Apologies, all of us have sort of been busy this afternoon. The main bit going forward is, as ever, what will happen, that the NHS will very much coordinate a response at a national level, a London level, and then very much us as part of the sort of wider North West London system will be reviewing the sort of salient points that the government have announced. And what will then happen is we will make trust specific plans to be taken forward. So anything that's been announced tonight by the Prime Minister will be working through tomorrow. I think if I have half competently followed the live chats and such like, I think that has been all the questions for this evening. On a personal level, can I just again say apologies for some of the technical issues when we've started. Hopefully we sort of managed to sort of canter through the presentations, which allowed sort of us to have a good time for questions and answers. So we're just coming up to the line about 6:25, and I'll pass over to the chairman now for closing remarks. Thank you very much to everybody.
I'd like to close thanking our executive team for their leadership of the organisation, and thanking all our staff for their hard work and dedication, particularly during the difficult times for us all, and to our governors and members for your continued support and engagement, and to everyone who's made the time to join us this evening. I just want to make sure that you understand the passionate commitment of your board to delivering a new hospital and very high standards of care and infection control in Hillingdon. And we know you share those aspirations, and we really appreciate that. So let's work together to achieve them. As our Trust Secretary said, there are slides and films available on the website for the next week. And if you want them or any other information arising out of this session, please do get in touch, and we'll be delighted to help you. So finally, I look forward to meeting many of you over the coming year virtually, and let's hope we get to the point that we meet personally as well. In the meantime, take care and keep safe. Goodbye.
It's been emotionally and psychologically very difficult. I think in a really positive sense, it's brought everybody together. We're only a small hospital, and actually there's a nice sense of community within the trust, and we've all made sure right from the top to the bottom that we look after one another.
I never thought I'd be a part of something like this, you know. Like, I thought when I trained to be a nurse, like, I'd just help a few people and that was it. But to be helping in a pandemic and having so many people recognise the work that you do, the teamwork has just been amazing.
It's been a very stressful time, and some of my colleagues have struggled with that, and so have needed support. But what I've really noticed is that we've all pulled together, and so there's a much stronger team working, which is great to see.
We cannot do our job without everybody's help.
First, I'd really like to say thank you to my team, from the nurses, the consultant, the doctors.
The doctors and the nurses are often given a lot of recognition, but our allied health professionals, our cleaners, our porters, who are also working in this environment and actually making everything possible for us to be able to care for our patients. So I'd like to say thank you to them.
I think it's the different teams I manage, it's affected very differently. Cleaning, catering, they're having to wear a lot of PPE, which they're not used to doing. But without them, we'd stop.
As a department, we rely on the porters, the reception staff, the cleaners, also like the catering staff. There's like a nice little team.
We're part of the whole hospital team and just getting on with it really and providing a good service.
Our workload is increased tremendously because you're trying to feed everybody, nurses, doctors, consultants, everybody. They're working 13, 14-hour shifts. It does make a difference to them. This is my Hillingdon family. It was before COVID and it will be after us. And we'll still be here. No matter what, we'll be here.
Not just doctors and nurses, but porters, our cleaning staff, our management staff, everyone has sort of like worked as a team.
Every morning, 6 a.m, porters come up to the wards and check for the oxygen cylinders in case someone needs O2 ASAP.
And how long have you been a porter for?
Me personally, I have to think back at least 15 years, something like that. I'm a people man, so I don't mind the job. Everyone in the hospital is important because we all do a job that keeps the hospital rolling. Regardless of their status, I don't look at anyone any different because everyone's the same in my eyes. It's all gravy.
Sometimes we don't really appreciate porters, the canteen staff, the cleaners, but in a time of COVID, it's actually them that are needed just as much as everyone else.
I feel privileged and proud. So many people have come together. We all need each other in order for it to work.
I'm obviously enjoying my retirement. I've got lots of grandchildren now, so enjoying time with them. And the decision to come back was actually, though, quite easy for me. It's kind of my second family, so I needed to come and support them.
Working here, we see each other more than we do see our families. So it's all about just sticking together and basically helping each other. Like, no matter if we're down, it's still our job. We still have to get on with it. We still have to do it. When something like this happens, you actually see what we are. We're a family unit, and to work with that it's a blessing. It's just not two kind of uniforms. We don't see each other as uniforms. We don't see each other as numbers. We're all human. We're all in one big family here, and we all work together.
I used to come in with my uniform, go home in my uniform, but now I've got like cuts on my face, cuts on my hands, from constantly washing, wearing a mask. But we have to do it. It's worth it though, because yesterday I had my first positive. I'm gonna get obsessed, sorry. Yesterday I had my first positive patient go home, so it was really good.
I think the people that I've worked with have demonstrated adaptability, bravery, compassion, sympathy, patience, understanding. I'm proud of myself, I'm proud of the team that I work with, and I'm immensely proud of my colleagues across the hospital.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you very much.